So prior to this Telehealth Tips Wednesday, we discussed logistics around using Zoom and how we might have to get people to stand up and move backwards in order to view them. And then we also discussed appropriate objective measures that could be used in the assessment process with a telehealth visit. And so today we were going to focus on treatment that can be done over telehealth. Yvonne or Rachel, have you guys provided any telehealth visits ever?
I've done one so far.
Okay, so with telehealth, a lot of it is on education and recommendations, and then exercise if the person is somewhat familiar with exercise, or if you can safely watch them perform a movement and know that you can prescribe it as an exercise. And there's also self-mobilization techniques that it is possible to teach someone. So with education, a lot of the times we're telling people about pain or acute management, so that you might tell them about ice and heat and the benefits of using either one of those. Compression, so wrapping a joint with a tensor bandage or using a brace or other item to provide compression. Right now, I've even pulled off of Amazon, oh, this looks like a good one, and maybe send 2 or 3 options to a client to choose from, because we wouldn't want to be telling them to go to the store to purchase something. So ordering something on Amazon is a better option right now. Anna, can you mute Simon? I think you can do it from your end. And so the other education that we might provide would also be on elevation. So elevating a leg. Robin, as in-home physiotherapist, we deal with a lot of lower body and leg injuries. So elevating a leg above the heart. So my favorite position to tell people to get into is on the couch, with maybe a pillow or 2 on the arm of the couch, and then the leg up there. So that's a good sturdy support that can elevate someone's limb, and it would be above their heart. Elevating a leg in a recliner chair doesn't cut it, and then elevating a leg while you're lying in bed with pillows, depending on the pillows, a lot of pillows just compress, and there's, even if you have 3 or 4 pillows, it's just not enough height to get effective drainage or swelling management of the limb. So it is best to put it up on the couch arm, the armrest of the couch. Does anybody else have any strategies for elevation management that they typically teach a client? Okay. So other education would be on, technically we don't talk about medication, but sometimes I do find myself recommending either Tylenol or Advil use, or the frequency of Tylenol or Advil use, and then also talking about topical. So again, right now we wouldn't want to be sending people to the stores to purchase a new topical pain relief, but sometimes people do have Voltaren or diclofenac lying around and they didn't realize, oh yeah, I could try using that on my knee or on my back or on my shoulder. Maybe a spouse has a topical eucalyptus oil, or there's so many different options for topical pain relief. So I always encourage people to try those out because it can be very helpful. Exercise. So exercise would be another treatment method that we commonly do. The telehealth clients I've helped so far are quite exercise savvy, and so they know terms like front raise, bicep curl, lunge. They know what these exercises mean. So it is fortunate that it's easier to teach and explain. And then remember, just with a video platform, you do have to, if you can't see them, you have to ask them to stand or ask them to adjust the level of where the computer or their phone or their tablet is at, in order to be able to properly watch the movement and make sure they're doing it correctly. Another option is to be able to share screen. So you can pull up things on YouTube. I have two screens here, so I'll just show you. Hopefully it's not, oh, it's going to show a bunch of music. I've been watching a lot of music on YouTube recently. So with Zoom, you have the option to share screen from the bottom, and then you can start a share screen. So here you could type in, like, ideally you would probably already have some exercise videos in mind that you know are good or that you know are safe, but you can teach or watch an exercise video through sharing the screen, and that could be a good way for the person to learn how to do a new movement. Since, yeah, teaching exercises by video is different than teaching it in person.
In order to do the shared screen, do you need a separate screen, or can you do it from a Mac?
You can
and open a new tab, or does that?
As far as I know, you can do it from the same screen. Everything, okay. all the faces, like the actual image of the client, will shrink on
okay.
PC, and it's still visible. I think we did say that one of our other
Kristen's having troubles with it.
Yeah, so we have heard that our other Mac user, like, they couldn't find where this screen went. But okay. There is a stop share. So I started the share, and then I just pressed stop share, and then you guys all appeared again. So.
Okay.
I tried to test it out on my iPad, but I haven't figured out where it all is yet. So I'm still playing around, but once I do, I'll let you know.
Okay. And can you make note of that to practice screen sharing with Kristen? And right. Maybe, I'm not sure if she knows about the start share, stop share, because if she just pressed stop share, then it should just appear, all the video faces should appear again.
Mm-hmm. Okay.
Other ways to teach exercise would be to actually demonstrate a movement. So again, you would have to make sure that you're in view enough to be able to show the exercise that you want them to do, and then produce the movement, reproduce the movement, and then provide feedback. So far, I have been emailing my client afterwards. So I teach them the exercises, they understand it, and then I email them just a short summary. So here's your program, 1, 2, 3, 4, 2 sets of 10, 3 sets of 5, whatever it is, so that they have it. There probably are other options for doing that more efficiently, but that's what I've been doing so far. And then I copy and paste the email into both either my chart note, or sometimes I just put it right in the chart note, because then it's part of the treatment. Prescribed home exercise program, emailed to client, here it is. Otherwise, if you did your chart note during the session and then you sent the email afterwards, you might send the email save the email in Jane as a separate note. So treatment, we talked about like pain and swelling management, education techniques, exercise, and then the other one would be self-mobilization. Jason, do you want to add anything about using exercise as treatment for telehealth?
Oh, I don't know what have we gone through yet, but I just had my clients today, so everything went really well. She was using the Zoom platform for a while for other businesses, so we got really lucky. She no problem going through all the exercises. It's just I gotta, for the shoulder exercises, I kind of gotta stand up in different positions, so side view or from that, so that she kind of get the idea on top of some picture drawing on the whiteboard. When they share the whiteboard, it's really helpful. So
that's another good idea of how to do it. So I was just showing how you can share screen with a YouTube video, how you can demonstrate yourself, but then you could also share screen with the whiteboard.
On the whiteboard.
Can you review with us how to get the whiteboard?
Yeah, so there's share screen, and on one of the options is the whiteboard, and you just click on share. Then there's my, are you guys able to see it?
Yeah,
Mhm.
but
Okay.
I still
Yeah.
don't see myself where that is. So
Huh?
I still don't see myself where it is. But so if you click on share screen and then it pops up.
Right. That's one of the options. So share screen. There, this screen, iPad, or your
whiteboard.
whiteboard.
Oh, I see it.
Yeah. Then click on share. So because with the video camera, it's kind of the opposite way. So if I want to do the right arm, it shows up on the left arm. So it's really confusing when telling her side. So I just just go over here. I don't have a mouth with me, but I usually draws a little bit better. So I tell her to on this side, so I put a left and a right, so that way she know which side is which. Then because some of the positioning involved the other hand trying to help herself to mobilize. So it's an active assist range of motion. So the right arm was helping to lift the left. So I the whiteboard she's like, oh yeah, that's perfect. So that's one of the features in there. Yeah, it's
The whiteboard would
helpful.
also be useful for education. So let me try it out here. So if I needed to educate someone on back pain and I needed to say, our spine is not perfectly straight from the side. We have these natural curves in our spine, and we talk about, well, that is not very good. I'd have to practice. But talk about the concavity we have in our neck and our low back, and then talk about how we have a bit of a natural curve in our upper back, and then the importance of maintaining this low back curve and this concavity in order to decrease pain, decrease risk of injury. So that's great. I always carry spare paper with me in a regular in-home visit and end up drawing and educating people that way. So it's great that there's the whiteboard option on Zoom to be able to educate clients as well. Great. Anything else you want to add about exercise prescription via a telehealth appointment?
I just show them real quick if it's an easier one for the shoulder, or I have a computer, so I gotta move the computer a little bit. So that's so ideally I would get a camera head so I can move and show where I want to show a bit easier. And I find out just using a lot of YouTube videos. So there's a physio tutor on their YouTube channel. So they have lots of special test demonstration and some of the easy exercises. So I send them a link, have them to look at it, and this is the thing. I go with them the same time. This is the posture I want you to get in. Do you have any problem? Do you have any concerns getting that? So I show a video rather than of a verbal description of where I want your shoulder and arms to be. So that is more efficient. Yeah.
Great. Okay. So we'll move on to self-mobilizations that could potentially be taught during a telehealth assessment. So one that I would be fully aware of that I often teach clients in the in-home setting is patellar mobilizations, particularly for anyone who's had knee surgery. These are important. So usually I tell them that their knee needs to be just slightly bent. So whether that's with one pillow underneath or a small towel roll underneath, the knee should be slightly bent. And then I usually demonstrate on myself, but maybe I would ask them to put the fingers on either side of their kneecap, and then I would ask them to play with it so that their kneecap, see how your kneecap can go side to side, see how your kneecap can wiggle back and forth this way. So that's what you need to do. You're going to do it 10 times. You need to keep your quads really relaxed when you do this exercise or do this treatment to yourself. And yeah, these are called kneecap mobilizations. Do you guys want to try that on yourself now? Hopefully my instructions were good enough for you guys to understand. So you would just have to have your knee in a resting position, so like about 10 to 15 degrees of flexion, and then you have to make sure your quads are nice and relaxed, and then you should be able to mobilize your own kneecap. And usually it feels pretty good, or it feels like just kind of soothing to have that normal movement, because our kneecap, as you guys know, floats in our patellar tendon, so naturally it should have quite a bit of play like in both directions. Yeah. Another mobilization that was taught in the course that Jason and Kristen took were snags, or basically doing neck mobilizations with a towel. So I'll quickly grab a towel. So if I were to teach neck mobilizations to somebody, I would probably draw on the whiteboard like how the neck is shaped, or maybe I would show a video on like showing all the vertebrae, because basically I don't think I would expect someone to find a specific level. We can find specific levels when we're palpating ourselves, but for teaching purposes or self-mobilizations, I would probably just ask them to do each level. So just start at the top and then gently, maybe you're trying to get right rotation. So then you're just going to gently pull with the towel in order to help facilitate and assist that movement. You shouldn't feel any sharp pain. It should be just maybe a gentle pull or a little bit of tension, but no sharp pain. And then you guys know the parameters, like might be 5 to 10 reps, and then ask them just to go down maybe one or 2 centimeters, depending on the length of their neck or the size of the person. And then again, and then they might find they have a lot of movement at certain levels, and then there might be one level that is really, really stiff, and then that is the one that they might have to do 2 or 3 sets on versus the other sets. So that is a way to self-mobilize, assist with rotation for the neck. And then remember our movement plane. So if you're trying to improve side bend one way, remember it's the opposite rotation movement. So maybe you're trying to improve side bend to the right, then you're going to get them to do left rotation moves, because that is the way those joints are coupled in our neck. Jason, did you learn any other mobilizations to teach that you could teach somebody via telehealth?
Yeah, well, not through that one course that we took, but there were a couple other ones, mostly for knee and hip, and you know, very similar for active assist range of motion. So we're using a towel or a rod for the shoulder for the passive motions. Yeah, so those are pretty basic ones.
So those would be range of motion exercises, like
Yeah.
using active assist to range of motion.
Yeah, either active assist or passive, depends on, you know. And you know, think about the body positioning. If it's against gravity, if they're able to lay flat on the floor or on the carpet, so that takes the gravity out of the game. So, you know, just a bit easier.
Right.
Yeah.
Yes, I'm actually helping a woman right now with a bicep. She would have had a grade 2 strain of her bicep, long head of her biceps tendon in her pec minor. So I've been doing I've taught, like, her progression has been teaching her active assisted range of motion exercise. So yeah, luckily I've got a dowel here, so I'll be able to progress her to those exercises today.
Yeah.
Can anyone else think of a mobilization that we might be able to teach to a client at home themselves?
I teach people like thoracic mobilization over a towel, lying on a rolled towel, and ankle mobs. If people are recovering from an ankle injury, you can teach them to do like glides of their tail curl joint using something like it's kind of the same idea as the towel, but having something where they're active. It's like a mobilization with movement. So they're actively moving while they're adding that mobilization to their own ankle with a strap or a belt or something. It's pretty easy to teach.
Very good. Those thoracic moves, I was thinking too, like if even like with the chair back, most people will probably be sitting in a chair when they're talking to us. So even using a chair back for thoracic mobilizations would be a good idea as well. Yvonne, can you think of any mobilizations that would be appropriate to teach somebody?
Nerve glide?
Oh yeah, nerve glide. Yeah.
So good for kind of neck, shoulder, and arm problems. I generally give this to people who might not test positive for a nerve tension issue, but it generally helps kind of relax the entire, I guess, quadrant in your limb.
Yeah. Oh, I learned a new nerve glide exercise from one of my exercise videos that I've been doing. Let's see if you guys can see me today. It's pretty basic. It's basically for like your hamstring or your sciatic nerve. But can you guys see me okay? Yeah.
Yep.
Okay. So the exercise would be lying supine with one leg out straight and the other one up, and then you bring the leg up straight. So first, I have the flexibility to bring my leg 90 degrees, but some people may only have it to here. And then I'm dorsiflexing my foot towards me, and then you bring it down. So you bring the heel down, and then you point your toes and come up like this. You ladder flex on the way up and dorsiflex on the way down. So for me, I actually, yeah, it's a pretty good, it's a good nerve mobilization as well as a like hamstring stretch. So most of our clients, like even our 80 and 90-year-olds, could do that one safely. So try it out after this. It feels
getting into that position, Kim, made me think of doing like muscle energy techniques for pelvic, like if somebody knows that their pelvis, I know there's controversy around it, but in my clinical experience, I have clients who definitely have a, anteriorly rotated one innominate, and you can teach them to use muscle energy techniques to de-rotate it and then stabilize with core exercises. So using hamstrings. So just, resisted thigh extension into your hands, sort of in the same position that you're in to rotate it posteriorly, and then teaching them core stuff to stabilize. I have a lot of people who get relief from those sorts of things.
Yeah.
And along the same lines, you can do thoracic muscle energy techniques. So if they're restricted into rotation, getting them to rotate and then hold on to like an arm of a chair and then resist them coming back to neutral, and using muscle energy techniques to improve their own thoracic rotation.
Right. Now, how would you assess or reassess that?
So for the pelvic, like I think that would have to be somebody that you had seen previously and knew that they had a pattern, because you can mess people up teaching them to do that stuff if you're not 100% sure that that's what's going on. But with the rotation, you can just you can get them visually to rotate for you and then do the exercise and then see if their rotation improves. Like if somebody's really jammed, you'll be able to see if they get more freedom of movement into rotation in a seated rotation, just visually, I think.
That's true, yeah. Oh, I just thought of another one. This one is for the sciatic nerve glide. So you get into that figure 4 stretch, and then you just go up and down like this. So as a treatment, I would probably actually ask someone to give me, on a scale of 1 to 10, their level of pain, or maybe do three squats. Does that bring on the sciatica? And then get them to do that 10 times and then reassess 3 squats or the pain level out of 10. So I think it's still really important when we are doing treatment via telehealth to still have a measure that we can use before and after to make sure that the treatment is effective. Does anyone else know any other good nerve glide exercises? So Vaughn was showing the one for the ulnar nerve, like that, like the wader one.
Sometimes I just get right arm,
Oh, your audio is cutting in and out, Simon. So that was like one for the cervical nerve. Okay, yeah. Oh, we can't hear you, but you're not muted. Okay. I collected a little bit of that. We couldn't hear you, but we can
Loose
see,
connection.
We can see what you're doing to the
I'm trying to
spine there,
yeah. Let's see.
the cervical nerve roots.
Can you hear me now? No?
Yes, we can hear you now.
A little bit better, yeah. So I was just saying, use your fingers to cup up in the cervical spine and just do a lateral glide away from where the radiculopathy is coming down the neck. Just a gentle glide to the left and just holding it for a couple of seconds, depending on the irritability of the nerve. Did you get that?
Yeah.
But they'd have to have good mobility in their shoulder as well, of course, to get into that position.
Yeah.
And obviously you progressed it onto like freeing the bird and all those other upper limb tension tests.
Right.
When they're able to do that kind of.
I do like full kind of, I don't know how science, like how evidence-based a lot of this stuff is in terms of whether we've studied if we're actually accomplishing what we're trying to accomplish, but it's like a segmental cat-cow. So you get them in a 4-point position, and then you get them to do like neck flexion and extension, and then try to isolate just thoracic flexion and extension, and then try to do sort of lumbopelvic flexion and extension. And then once they've done sort of 4 or 5 repetitions in each segment, then you do the whole thing. And in theory, I've seen with people who I would call clients who have tight dura that actually helps, but it's just like you're just mobilizing the spine in a really nice active way using the breath. So there's lots of components there that are going to help with tissue relaxation and improved respiration and increasing, vagal nerve activation and tone, because they're doing lots of deep breathing. And so you can get like people who just seem wound up through their nervous system to get them to do that, to kind of loosen things and calm everything down. And it's a pretty straightforward thing to teach people.
That's another part of education, is the deep breathing, because we all know how deep breathing can affect the nervous system. So all of us should be teaching deep breathing at some point during our treatment.
Especially right now. I do it all day. I'm like, okay, I'm gonna go take 10 deep breaths and I'll come back and help you with your mouth in a few minutes when I've calmed down.
I wonder if you'll have a new respect for what Kareem does.
I didn't need a new respect. Like, I already had a lot of respect. I think teachers are super undervalued and underappreciated, but I know why I never became one now.
Yes. All right. Well, thank you everyone for attending our Telehealth Tips Wednesday. For next week, we'll probably share more assessment and treatment that we can do. And then also, I expect more of us will have had more telehealth visits by then, so we might have some success stories to share. And this will be recorded, and the link will be in the next Empowering Lives weekly email if you guys want to rewatch it, or hopefully we can encourage the other team members to watch it. Okay. Thank you, guys. Rachel, can you stay?
Yeah, I'll stay.
Thanks, guys.
Thank you.
Thank you.